Keeping the weight off after weight loss surgery can be a challenge. Hartford Healthcare is hoping to prevent their patients from gaining those pounds back. To tell us about a new study, we have bariatric surgeon Dr. Pavlos Papasavas with us to tell us more about it. First of all, when somebody undergoes bariatric surgery, most of us think that that person will not likely gain that weight back, but there are people who do.
That is true. Thank you for having me today in your show.
You're so welcome.
So bariatric surgery is very effective in controlling weight, obesity, and all the diseases associated with obesity, such as diabetes and high blood pressure and hyperlipidemia, but it's not a cure for obesity. It's a chronic disease, and there's no cure for it. So we are very interested in predicting outcomes after bariatric surgery. And we're very excited about this grand opportunity. It's a collaboration between Hartford Hospital Bariatric Surgery Center and the All-in Neuropsychiatry Research Center at the Institute of Living at Hartford Hospital.
What's the percentage of people who undergo this type of surgery actually gain the weight back? Is it 5%, 10%?
There are no good studies to estimate that, but we estimate about 15 to 20% of patients may not achieve their goal, or they achieve the goal and they gain weight back. And we're very interested in studying how the brain reacts to food and how does this reaction change after surgery.
So why is it that, I mean, the premise of the study, why is it, what is it do you think is causing this?
So the study involves getting people in an MRI machine.
Yes.
And we are obtaining live images of the brain. We expose them in food cues. So we show them pictures of healthy foods, blueberries, and then a cheesecake, and we see which areas in the brain light up. The reward centers that make us want these foods, and the control areas that tell us it's not healthy, don't eat it. So it's a battle within the brain, and it's very exciting to see how this battle changes after surgery.
And so far, have you started the study?
We had a pilot study of 65 patients.
And what did that pilot study tell you?
We were able to predict 55% of the weight variation at 1 year after surgery, which is huge.
That is huge.
Yes.
So what types of risks are there based on that pilot study? What will you be narrowing it to? Certain factors?
So this will be a larger study with more patients, and we'll follow these patients over a 5-year period, and we'll try to come up with a prediction model, identify the people who may not do well after bariatric surgery, and help them with other means. That could be a medication, it could be behavioral treatment, it could be coaching. Try to help them to reach their goal and maintain that goal over a longer period of time.
And this is important because this will absolutely benefit their health.
Absolutely. It's a fight against a very chronic and very difficult disease.
When we say they gain some of that weight back, how many pounds do they generally gain back?
If they lose, let's say, 100 pounds, they may gain back 30 or 40 pounds. Some people may gain all the weight back, and these are the patients who are concerned most about. Try to identify this trend early and try to fight it.
Exactly, because as we just said, their health is so important here.
Absolutely.
When it comes to obesity. And how does one get to participate in this study?
We have not started enrollment, but hopefully it will be starting within a few months. And then people who are going through our center for weight loss surgery will be approached to participate in the study.
So it'll be folks who will be part of your center at Hartford Healthcare.
Right. It's imaging of the brain before surgery and every year after surgery.
Okay, well, can't wait to hear what the results are. This will certainly help so many people.
Thank you very much.
So much for joining us, Dr. Papasavas.